we're talking about obesity, which is linked to an increased risk for 20 different chronic diseases, including heart disease, stroke, diabetes, and cancer. Nationally, we're spending $147 billion on medical costs associated with obesity every year. And even Vermont, which is considered one of the healthiest states in the nation, is spending $163 million on medical costs related to obesity just on the Medicare and Medicaid's expenses alone. It's a pervasive problem. Over 58% of Vermont adults and a quarter of our kids are either overweight or obese.
There's a fiscal and economic imperative to this as well. Government continues to spend increasing amounts on health care reform, on health care needs, on health care provision, and that's going to crowd out resources that we need for education and other important public services. We need to have a fit workforce, and in an era when we have fewer young people in Vermont, a changing demographic, we have to be sure that each and every young person is able to work, is healthy, and can make a meaningful contribution to an employer and indeed to our society.
At the Y, we have a focus on health in kids, whether through our child care programs, our swim lessons, our after-school programs. We're always looking for ways to bring more resources into the state. We're focused as an alliance on developing policies that create environments for Vermont children and families that support active living and healthy eating where they live, eat, work, and play. Over 50 different leaders around the state have worked with us to develop an agenda that will address obesity in Vermont. Now, our initial focus is we're actually looking at 3 different areas. We're looking at nutrition and physical activity, but in schools, in childcare, and this on increasing access to affordable, high-quality foods for all Vermonters. Now, today we're here to talk about our school piece, in particular our school piece. You know, children spend over 30 hours per week in school. And they are developing diet and exercise habits, both positive and negative, that they'll take into their adult lives. Schools are asked already to fit so much into their day, and already, unfortunately, sometimes fitting in math or science means that it's coming at the expense of PE classes or recess. We as an alliance believe that PE and recess may not be the best choice to cut, especially when research shows that physical activity throughout the day will have a positive impact on the overall health and ultimately the academic performance of students. After meeting with the leaders in the fields and looking at national best practices, both alliances believe, and we've been working closely with Live Healthy Vermont as well, that we should prioritize PE and physical activity and standardize practices at all Vermont schools.
A year and a half ago, the idea to start a program of running and walking in the mornings at the Integrated Arts Academy began with a school social worker, Kara, our school nurse, Louise, and myself. And the program grew out of a response to student needs. We had students that were outside and in the morning and looking for something to do. Our days are pretty packed, so it seemed like an awesome experience, according to Dr. Ratty, too, to get our cells moving before we get our brains engaged, that it helps with that. So that's kind of how our program got started a year ago, and the Move It, Move It program at IA was born.
What I like about Move It is in the morning, if I'm mad about something, I just run and it makes my day better.
I like doing Move It because when I wake up, when I'm sometimes late, I just like to start in it and it gets me more energized.
I like Move It because in the morning, it wakes me up when I'm tired. It gives me enough strength to run and do stuff that I really like to do.
I basically just do it for fun. Move It is fun.
I have a lot of energy in the morning. I can just get it out. And I really like running a lot because then in the day, if I, it just really gets up my energy and gets me really exercised.